Hello and welcome to Healthcare in the Know, sponsored by Bright Star Care of Venice and Port Charlotte. My name is Justin Willis and I will be your host today. We are discussing Medicare. We have Karla Blake, the Medicare specialist, here in-house with us today. How are you today, Karla?
I am fine. Thank you for inviting me.
No, thank you very much for coming on. Medicare is something that people really need more education and information about, so any chance we get to have somebody with your extensive knowledge on the show, it's always a great opportunity for us and the listeners.
Well, thank you. It is a hot topic for sure. I know that when people turn 65, they are inundated with information pertaining to Medicare. It is, very confusing for most seniors. And to be able to sit down with someone who understands Medicare and to have it mapped out and explained to them, so to speak, the A, B, C, and D of Medicare, that they have comprehensive understanding. It helps them to make informed decisions, because this is going to be the insurance for the rest of their life.
Absolutely. Well, I mean, you're already bringing up some topics that we can lead into questions with. What is the difference between the A, B, and C of Medicare?
I'm glad you asked. These are great questions. Medicare Part A is your hospitalization. So that is everything to do with your hospital stay. Okay. Medicare Part B now gets into your doctors, your specialists, outpatient care, diagnostics, tests, medical supplies and equipment is falling under your Part B. So A is hospitalization, B is your doctors.
So B is your day-to-day health care.
Correct. And actually, your Part A is something that you will just get when you turn 65, but a senior will actually have to apply for their Part B. There is a narrow window of time where they can actually apply. It is a 7-month window, 3 months before their birthday month and 3 months after their birthday month. And that is a time where they will actually, decide with Social Security if they want to take a Social Security income. Some seniors have taken an early income at 62. When they apply for their Part B, there is a premium attached to that. So for a senior, an average senior who's making under $85,000 annually, their premium for their Part B, which would be taken out of their Social Security check, would be $135 a month. Now, that is a premium that everybody has to pay. Welcome, to Medicare, and that is for the Medicare benefits.
Right.
So your Part B, encompasses a premium for all. And then like I said, that's something you apply for. If you choose not to collect a Social Security income yet at 65 and you want to wait, because you're going to get more money if you wait.
Right.
There's benefit to that. Then you're actually billed quarterly for that premium, for that Part B premium. Okay. So your Part C is an Advantage plan, which I think we're going to talk a little bit more about the difference between Advantage plans and Original Medicare, which is 2 choices that a senior has when they turn 65. What they decide to do, whether they want an Advantage plan or they want to stay on an Original Medicare with a supplemental policy. But Advantage plans are considered your Part C. Part D is your prescription drug plan. So if you have standalone Medicare, you need a Part D for your prescription drug plan. So leading into what I just said, when you turn 65, you actually have 2 choices. So your first choice is, as I said, Part C, which is your Advantage plan. And that's where they're just bombarded with flyers and information and TV commercials, especially during your open enrollment period.
Is that the AARP insurance you always hear about?
Well, it's not only AARP. There's Blue Cross Blue Shield. There's Humana. There's Freedom. There's so many choices when it comes to Advantage plans. But it narrows down to a plan. Now you've allowed that company the company, whatever company they choose, to take over their Medicare A and B. So now they're part of a plan. It's a government subsidized HMO. They could also choose a PPO, but most seniors are choosing the HMO. So now you have a government subsidized HMO. You need a primary doctor who needs to give you a referral to a specialist, and now you need approvals for procedures. So something like a knee replacement.
Right.
Let's use that as an example. You know, we have so many golfers here in South Florida in their retirement, and a knee replacement is a very common outpatient procedure, which falls under your Part B. It wouldn't fall under A because it's outpatient, it's not hospitalization. Whereas if you had a heart attack and you're having an open heart procedure, that would fall under A because it's hospitalization. So your Part B, a knee replacement, let's say, they're going to have to go to their primary doctor. Yes, your knee needs to be replaced. Now let's refer you to an orthopedic. So now they need a referral to their orthopedic, which the orthopedic won't even set up an appointment with them until they're approved for that.
That's a lot of work just to get in to,
well, let's not
ortho.
say it's not just a lot of work. It could take a lot of time.
Right.
You know, and that's the key.
So
now,
there's a better option to this then, right?
Well, there certainly is, but let me finish because because this is important. Because now they're at the orthopedic, and the orthopedic has agreed that they do need a knee replacement. But now that orthopedic needs an approval for the procedure.
Right.
So now he can't just schedule this. He has to wait until he hears back from the company. So start to finish, it could be a 3-month process.
Wow.
Now, what you've allowed that company to do is take over your A and B. So now you're not allowing original Medicare to represent you as an insured.
Right.
You are now allowing the company of your choice, and that's the card you're carrying, that's the card you're giving the doctors, so you're staying in that network of doctors.
Right.
So now you have co-pays, co-insurance, and
limitations.
And out-of-pocket expenses.
Wow.
So in other words, you have in-network deductibles and out-of-network deductibles. Let me explain. I have a client who has a house in Palm Beach. They also have a house in New York. They have a nice big RV. So they get in their 30-foot RV. They're driving from Florida to New York. She steps out of the RV in South Carolina and twists her ankle.
And she's out of network.
She's out of network. It cost her $6,700 out of network.
That's crazy.
So the alternative, as we said, is where now you allow original Medicare to be your primary. And remember, Medicare is always set up to pay 80%. So Medicare is going to pay 80%, and a supplemental policy picks up the gap. So now you have a supplemental policy, also known as a Medigap policy, and that will pick up your 20%. So now Medicare is your primary. You can go to any doctor, any specialist, any medical facility, anywhere in the country. And now you're paying a monthly premium for a supplemental policy, which now covers any out-of-pocket costs. So really, you know, the Advantage plans will often mislead the consumer or the senior because they're saying it's free, free, free.
Right.
But then they're not adding up the co-pays, the co-insurance, and the high deductibles.
Exactly.
They're not adding up that, okay, that knee replacement will now require 6 weeks of physical therapy, 6 to 8 weeks of physical therapy. And when you meet with the physical therapist, you have a $40 to $50 copay 3 times a week. So that could be an additional expense that they have not factored in, where original Medicare is going to cover that for them. So now they can go to any doctor. Now, another very important thing to understand is a lot of the hospitals, like the #1 cancer institutions in the country, if you get into Mead, John Hopkins, Sloan Kettering, you know, these MD Anderson, even UM here in the state of Florida, you know, you have UM in Miami, you have Moffitt, you know, in Jacksonville, you have these hospitals that will only take original Medicare.
Right.
And so now someone is faced with cancer. And that's the C word none of us want to see, none of us want to hear about. But the statistics are 79% of us can be diagnosed with cancer at some point in our life.
Right.
And when that happens, now you're faced with, okay, my insurance doesn't cover this. What do I do? Now I have, this diagnosis. What do I do?
Right.
When you're turning 65, you're a guaranteed issue.
Exactly.
And so often people come to me when they've already hit that point where, okay, I've been diagnosed with this. I've been released from physical therapy earlier than what my doctor wanted me released from physical therapy for. But now I'm stuck doing this at home, or they become a burden to their family, or skilled nursing isn't covered under their Advantage plans,
right.
And they need to get back onto original Medicare. I've worked with a lot of the assisted living facilities, here locally, where their residents need to get back on original Medicare.
Right, so the Advantage plans don't have coverage for that long-term care situation.
Let me say this. Every plan is different, Justin. And so often they have an agent who really doesn't know, because what they're doing is writing an application.
Right.
So when it comes to the Advantage plans, they're writing an application. Now they have a 1-800 number that they have to call when they have questions or concerns. Again, they're staying in a network. So when you're in a government subsidized HMO and you have to stay in your network of doctors, even if you have a PPO, you may not need a referral with the PPO to go to the doctor, but you still have to stay in that network.
Right.
So if you're in a blue network, you have to stay within Blue Doctors or Humana, or as you mentioned, AARP, United
right.
Healthcare. These are plans that you have to stay within those network of doctors, or now you're getting into out-of-pocket
United
expenses.
Healthcare owns AARP? Is that what I heard?
No.
Or were those two separate companies that you were mentioning? Sorry.
No. United Healthcare does not own AARP. AARP endorses United Healthcare, and that contract is set. I'm not sure yet whether they will renew in 2022, but that is the allotted time, for AARP to endorse United Healthcare as.
Oh, wow.
Yeah.
Oh, interesting.
So it's not owned. Endorsed by is what AA.
Okay.
But AARP, let's face it, is a very trusted name for a lot of seniors.
Right.
Because let's face it, we turn 50, and all of a sudden, all that information starts coming in the mail. Right. AARP, welcome. Get your free cooler. Yeah.
And they're sending it out younger and younger. It's funny. Me and a few of my friends have received an AARP invite card,
what?
And I'm only 31. They're about 34 years early on their.
I'm just a few years older than you, Justin.
Well, for anybody that is just tuning in, this is Healthcare in the Know, sponsored by Bright Star Care of Venice and Port Charlotte. And today's guest is Karla Blake, the Medicare specialist. We're discussing Medicare, Advantage plans, and a little bit of everything else in between. We thank you for joining us today and hearing our show, and hopefully we're giving you some information that helps out in your life or with the loved ones that you're dealing with on a daily basis. So we've gone through so far, what kind of plan are you really looking for? And I've learned a lot realizing that the Advantage plans aren't picking up as much as I assumed that they did, and that with basic Medicare, the true Medicare program, there's actually a lot more benefits to being on that Medicare, that straight Medicare program, and also buying a supplement to offset it. I think you called it Medigap or something.
It's a Medigap or a supplemental policy, correct.
Right, and those are relatively affordable, so correct. In comparative to
Actually, it's far more, if I could interrupt, it's far more affordable based on the fact that you have now a monthly budget that you're going to spend for A and B.
Exactly.
Now,
I'm thinking, you mentioned a broken arm costing $6,700 or a twisted ankle, whatever it was.
Well, because it was
versus being out of network versus where if you had that basic Medicare program,
that would have been covered.
It would have been covered
100%.
Completely, and
Correct.
she would have only been spending a couple $100s a month versus $7,000 plus the cost.
And she does now. because now she does have a supplemental policy after that experience. But just so you know, there's also a Part D, and we didn't have a chance to touch base on a Part D.
And that's the prescription. And
that's where your prescription drug plan comes in, and that has to be coupled with your supplemental policy and original Medicare. See, when an Advantage plan takes over your A and B, most Advantage plans also include your Part D. Now, when you have original Medicare, you have to pick up the supplemental policy, but you also have to pick up your Part D drug plan.
But there's all kinds of drug cards out there. I mean,
well, there are actually right now in 2019, to be exact, 27 different drug plans that they can pick from. So what I like to do as an agent is I actually will go on the Medicare.gov website. I take the human factor out of that entirely, out of that equation, and I just get their prescription drug plans. I put them into the website, and the absolute best plan that comes up with their drug formulary is the selection that I make, choosing their drug plan. Now,
based off of their need, not what...
Based off of their need.
Right. So here's something I'm going to ask you to do real quick. For any listener that's out there that is interested in getting a hold of somebody who specializes in Medicare, hopefully they're going to be calling you. Would you mind giving out your phone number for them to reach out to you?
No, that would be my pleasure. My cell phone number is 954-612-1754.
Go ahead and say that one more time.
That is 954-612-1754. Now, I make myself available for my clients, and I also want to say during that AEP time, which is
annual enrollment
period. The annual enrollment period, which it's the annual election period is what it actually stands for, but it starts October 15th and runs through December 7th. Now, that is when people can party hop from Advantage plan to Advantage plan, or change from, an Advantage plan to a supplemental policy, providing that they can answer underwriting health questions. But it's also a time when they can change and select their drug plans. So a lot of people don't realize that once they select a drug plan, they don't have to stay with that plan for the rest of their life. So the drug plans kind of work creatively, we'll say. They will hop around on who offers the best deal for that particular year, and it may change if they don't make a change. So they'll say, well, I just want to stay where I am. This has worked good for me. But after looking at their drugs and seeing that maybe the following year it may change on them, and it won't be as good as it is now, and they won't know that until they get to the counter in January to pick up their prescriptions, and then they're stuck. So for my clients, I like to shop that Part D for them, and it's a service that I offer for just my clients, so that I can make sure that whatever changes may have taken place during the year when they go to their doctor's appointments in March or in June, and something happened and their formulary has changed, that we're actually selecting the best plan for their up and coming year.
Absolutely.
Because they can't make a change. They're stuck with it. So if they go to the doctor in June and they get put on a prescription, that they can't afford, or they don't want to spend the money on, then we work creatively to find how we can provide discounts for those prescriptions. Because unfortunately, someone who's a type 2 diabetic and they need insulin shots, and these are life-altering prescriptions, and it makes a difference for them and their health, and it's important. Or even asthma, and they and they're having to have inhalers. These are expensive prescriptions, and so they need a bit of creativity. And there's been plenty of times where we're contacting the pharmaceutical company directly and getting the extra help that they need. So it's beneficial to have an agent.
So one of the questions I had for you was, when could you apply for that Part B? Is that during that annual enrollment period?
Good question. Actually, your Part B is based on your 65th birthday month.
Okay.
Okay. So You have 3 months before your birthday month, and you have 3 months after your birthday month. It's a 7-month window to apply for your Part B without a penalty.
So what happens if your employer is already providing insurance for you at the age of 65? Do you lose your insurance? Is that something you can work through? Do you have to take Medicare? It's if you can only apply during that 7 months and you choose not to take it, then what happens? I guess I just asked you like 6 different questions.
No, you've asked great questions. I'm really glad you asked these questions. So let me try to attack them one by one.
Okay.
If they are currently working and they have employer coverage, I highly recommend they still apply for their Part B. Medicare will always look better than what under 65 looks like. They will find that they are paying premiums and that their premiums have co-pays, co-insurance, and a high deductible annually. And so it is always more beneficial to apply for their Part B and, taking Medicare over the employee coverage. Oftentimes employers are willing to pay for their supplemental policy because it's going to save them money. Correct. It's going to save them money. I think you also asked...
so what happens if you turn 65 and you're still working? So you can keep your insurance.
Now, if you choose to keep your insurance, you're not penalized because you have credible coverage. Perfect. So when you apply for your Part B, you're not penalized. However, your premiums are going to be higher because Florida is an age issuance state. So it's ideal to lock in your premium at the age of 65 because it's the lowest it will ever be. So if they choose to wait till 70 and they've stayed on employer coverage, they're not going to be penalized for that, but they will, pay a higher premium. Now, also, that being said, if somebody is not covered and they do not know that they have to apply for their Part B and they've missed that window, that 7-month window, there is a time in the beginning of the year from January 1st to March 31st where they can now have an open enrollment for their Part B. They will be penalized for the rest of their life for not applying when they turn 65.
Really?
Yes, they will be penalized. They also will not get coverage till July 1st of that year. Wow. So in other words, someone can't experience heart condition or a stroke or any kind of catastrophic event and then say, oh my gosh, I need Medicare. I don't have the coverage I need. This out-of-pocket cost is going to be exorbitant. The government has kind of protected itself that way to say, okay, you're not going to get immediate coverage. Not only are you going to be financially penalized for the rest of your life, but now you're going to have to
you're going to pay with your health care as well.
You're going to have to wait to have the coverage till July 1st.
Right. So ultimately you're paying financially and you're paying more out by not taking the Medicare, and then on top of it, your health can be affected because let's say you need something that insurance that your employer was providing didn't cover. You need that Medicare to take place, but you could be waiting 4 or 5 months before you get there. It's, Karla, I want to thank you again for coming in and speaking with us today.
Thanks for having me, Justin.
I hate whenever we come up to the end of the show because I start looking up and I realize how much we've talked and how little time is left in there.
Right.
So
we ran out of time and we have so much more to say.
Right. Well, I'd love to have you come back and discuss this farther on another show. But for somebody that is just getting to the age of Medicare, which is 65, so they're 63, 64, 65, they're looking at getting their insurance, they have Medicare currently, and they're looking at making a shift during the annual election period, how do they get a hold of you again?
Just so you know, they do not have to wait to make a shift in their annual election period. So getting back on to original Medicare, there are ways to make that happen in the right circumstances. They just have to know Medicare laws. Perfect. If somebody wants to get a hold of me, again, my cell phone number is 954-612-1754. Again, it's 954-612-1754. I have an office in Broward County, and I also have an office here in Venice.
Awesome. Well, this has been Justin Willis with Healthcare in the Know, and today's guest was Karla Blake, the Medicare specialist. We greatly appreciate you coming on and speaking with us, sharing this great information, and I want to thank you all for joining in today and listening with us. And always remember, be happy, be healthy, and be safe.